of the programs really fragile. So here our main ask is really to protect this dual track financing and to ensure that gender programs are not lost in the transition, same as the MENA and LAC region. And speaking about MENA, so here the context is really more restrictive than other regions, with a high level of stigma and discrimination, criminalization, and limited civic space for civil society organizations. So the Global Fund investments in MENA region have been really cautious. So they either focus on maternal health or SRHR, but gender transformative work remain extremely limited, with limited funding, and it's often invisible in many countries of the MENA region. So what we need here is really some context-sensitive advocacy to try to secure some measurable commitments like stigma-free SRHR services, and to try to support grassroots organizations, women-led organizations through some regional platforms and remote work. So this is the main analysis that we've been able to do for the Global Fund programs. So I will give the floor now to Andrea to continue the presentations. And if you have any question, please don't hesitate. Thank you.
Thank you, Alia. Thank you so much for the presentation. You will be able to see the regional analysis in a moment when I present the communication advocacy toolkit. But now, in this process of highlighting the priorities, needs, and especially the needs of investment in the regions, we are very glad and we are very honored to have incredible speakers today. With knowledge, with knowledge from a global perspective and regional perspective, not only on Global Fund but also on mobilizing women and girls. And so now I want to give the floor to Katie Wright from Global Fund Advocates. She will present today a perspective from GFAN on the aid replenishment campaign. So Katie, I'm going to make you co-host so you can share your screen too also. Let me know if you can do it. Yeah, allow.
There we go. Perfect. Thank you. There we go. Can you see my screen?
Yes.
Yes.
Perfect. Okay, so I am going to share these slides afterwards, and so you can see all of them, because I'm just going to actually skip really quickly through some of the slides that we had at the beginning, because we just weren't sure, and just jump right into sort of our findings from the results report. So for those of you who don't know me and I haven't met before, hi, and thank you so much to colleagues for inviting us to the call. My name is Katie Wright, and I'm the director of the Global Fund Advocates Network. Some of you may be involved and join GFAN calls and those kinds of things, or you may be involved in our regional partners in Africa and Asia Pacific. And if you haven't heard of us before and are interested, we'll be sure to share information with you about how to sort of get involved when we're finished here. But there's a lot of, so this results report is something that is published annually by the Global Fund, and it shares results from the previous year and sometimes the previous 2 years, depending on how and when some of the indicators and some of the data is actually known to the Global Fund. So there tends to be a bit more of a lag in TB statistics versus malaria or HIV. But there's a lot of interesting data, and if I really had to sum it up in sort of like one way in terms of this report, is that the Global Fund does continue to make really impressive and important strides and progress to reach more people and have progress against the 3 diseases, but that progress is at risk. And I think, you know, picking up on some of what Alia was saying in her presentation, when it comes to this particular year, there's a lot of sort of changes in some of the key numbers and the key findings in the report, where it does make it seem a little bit more challenging to see what is being done and invested in gender transformative, in particular, work. That said, it also talks about, the fact that there are more adolescents and girls facing HIV and acquiring HIV every year than boys, for example. But if you look over time, investments, for example, in the report, they talk about Malawi being an 89% or an 86% decrease in HIV incidence among young women since 2010, which is impressive. But also some of those numbers didn't change as much in the last year as we might have hoped. So when we try to share information with our members over GFAN, we do create different tools that hopefully help colleagues understand. And so we did share, and this QR code will show for you a quick narrative that we did on the results report, as well as what we call a cheat sheet. And you have the author of the cheat sheet here on the call with us, my colleague Vita, who pulled this together. So if you do follow those QR codes, you will see it on our website. And it does sort of just give you some of those high level sort of points across, as well as some key messages and some key findings that we found from the report. So again, just to go back to sort of the broader thing, there are some really great signs of progress for this year. Through one particular private sector partnership, a certain number of vaginal rings to push those out, to bring the cost down, to try and increase demand and expand access of this important part of the toolkit for women living with HIV. That was an important effort this year, and a new one that they did. The Global Fund did reach 2 million adolescents and girls, young women with preventative services in 2024. And they did reach a large number of pregnant women with malaria and HIV preventative therapies. But that said, those numbers are a little bit lower than they have been in past years, which is what gives people a little bit of pause and some concern. But if you do have an opportunity to look at the full report, you will see that there is some explanation for that, in the sense that 2024 is a bit of an odd sort of transition year for the Global Fund and its programs. It did sort of finish some of the sort of catalytic investments it was making, where it was broadly looking at adolescent girls and young women across a larger number of countries, and now is more focused through things like the new Gender Equality Fund, which is a partnership with 2 private sector investors as well, to really focus on adolescent girls and young women services in 8 sort of priority countries, which does build on years of sort of progress and innovation that was done through other initiatives such as Her Voice and Voix Essentielles. And those were great and continue in some regard. But the focus has been to prioritize in a smaller number of countries to increase impact in those countries. So the important thing, when we talk about this, to know is that there are things that are at risk, right? Like, we all know that, you all know that from the work that you do. And there are concerning things in this year's report compared to like last year's report, for example, where overall HIV prevention in countries where the Global Fund invests has decreased by 31%. Now, the Global Fund in its report does try to explain some of the reasons behind that, which are possibly as much about the sort of technical aspects of the work. But it is something that I think we should be concerned about, and we should be watching, especially as we are working forward out of this replenishment towards the next sort of cycle of grants that will be awarded. And just in general, we just feel like, with the broader context that, again, you all know, we all know, the rapid defunding, bodies of work that are collapsing, we can't sort of let this be the story of the coming years. And so in terms of some of the more specific stuff in the report that you can find around sort of with a gender lens, if we were looking at all of this with a gender lens, like programs are focusing more on high risk and they are instead of sort of more broadly. And so that has led to significant drops in countries like Mozambique, Nigeria, Kenya, Tanzania, and Uganda in terms of global fund facing investments. That said, it's not possible necessarily to say for sure that is an overall cut that has happened, because a lot of the programs that were in place have reached their sort of conclusion because in some cases the investments have been absorbed by other ministries, for example, with domestic resources, which could partly explain some of that sort of reduced reach. The global fund contributions are also always only one part of, a bigger picture in terms of the overall resource envelope. So declines in a country may not necessarily mean, declines from global fund space and with global fund funding does not necessarily mean an overall decrease, but it could. And it's important for us, I think, as advocates and as people working with and representing communities living with HIV and women living with HIV. I think we do need to get a better handle on that. And it remains sort of too early because of where we are in sort of the cycle of implementing global fund programs. It remains a bit too early to sort of understand the impact of the shift to high-risk targeting on incidents, especially given challenges in identifying adolescent girls and young women who are at risk, and that sort of just general catastrophic withdrawal of PEPFAR DREAMS funding in particular. So community-led monitoring will be really essential to understand whether these shifts that we're seeing in the results report are reducing access to prevention services for women and young girls more broadly, or whether we see the impact being lessened by other investments, by governments, by other sort of funders, et cetera. And for us here at GFAN, we always, the reason that we sort of care and why we work on these things is that all of these numbers, all of these statistics, of course, it's not about the statistics, it's always about the people. And these are some of our wonderful speakers from left to right, Annie, Priscilla, and Crystal, who are all women who face HIV challenges and MDR, TB challenges, et cetera. And because of the Global Fund, they were able to access treatment in a timely way and supports in a timely way and continue to do work in their communities. And so, you're welcome to check out our Here I Am campaign website to learn more about our speakers, but also the work that we do to make sure that human face of sort of progress, but also what could be at risk is there for colleagues. I'm not going to go into this too much because I think that Angela is sort of the best person to tell you and already sort of spoke to why it is that we need to continue to center the Global Fund in our advocacy around women and girls. But again, I will share all of these slides, but I did just want to quickly go over a number of different resources and advocacy tools that we've created as GFAN, not just about the results report, which I just sort of talked about, the cheat sheet and the narrative, and the Here I Am campaign, which is what I just talked about in terms of that sort of human face on the progress and the risks, but also that you can find on our website, you can find where we're tracking sort of all of the pledges to the Global Fund Replenishment campaign that are coming in. So sometimes give us a few hours. We have colleagues across the globe. So sometimes they come in when they're already asleep, but we do try to do our best to keep that up to date. We also have a number of resources around what we've called our main sort of replenishment resources around how to close a funding gap, and more recent ones around what it would take if we could maintain G7 investment levels, what it would be taking in the next few months to get us to a point where we could maintain investments in the Global Fund from GC7 to GC8 in terms of levels of country allocations and catalytic investments. And also we find that a number of our colleagues are often facing sort of anti-ODA narratives as they're talking about the need to invest in the Global Fund or the need to invest in health in general. And so we have created a reframing solidarity toolkit that, again, you can find through the links that hopefully helps you combat some of those narratives that are negative, but that we often see in different places. So, and the last QR code is how to stay in touch and join our listserv. It's an open, free membership, and we welcome everybody to join us and always to stay in touch with us. And in particular, especially if you're new to these tools and it's the first time you've heard from us, it would be really great to know now on the call or at another time whether or not some of these tools are useful to you and how you might use them in your advocacy or ways you could do better. So I'm going to end there. I hope I haven't gone too far over my time, but thank you.
Thank you so much, Katie, for that amazing presentation with the numbers, with statistics that just show us how exactly women and girls are affected with the cuts. And thank you so much for all of the resources. We also link the GFAN campaign on our toolkit, so people can also read all the amazing materials that you developed. I now want to give the floor to our next speakers that are representatives from different regions, and they're going to talk about the priorities and needs of investment from the perspective of their countries and regions. So now I'm going to give the floor to Bester Mulenge. She's from Zambia, and she's also our national focal point. She's here and she's going to speak about Zambia and sub-Saharan countries, priorities and needs. So Bester, the floor is yours. I see you there. And also, before I give the floor to Bester, I want to encourage you to use the chat to introduce you, to connect. I see that we are already 69 people on the webinar, so that's amazing. And please use the chat to introduce yourself and connect. And now, yes, Bester.
Thank you so much, Andrea, and good afternoon to everybody. Hope you can get me. So I'm just going to give some of the initiatives that Zambia has had before I go to the sub-Saharan African countries. And for Zambia, we have rolled out a layered approach for adolescent girls and young women, and also combining HIV prevention, education support and social protection, and GBV mitigation. Then the other interventions that we have done as Zambia is working with Dreams. That is one of the initiatives that has helped us map and target adolescent young girls that are HIV positive and ensuring that they are able to take their medication, not devoting to their art medication. The other thing that we have, the other initiatives that we have also is working alongside the Ministry of Health. And I must confirm today that Zambia has now moved from the prevention of mother and child transmission. We are now integrating it to elimination of mother and child prevention, because this is some of the things that we're looking at even on the Global Alliance under Pillar 4, which is also helping us to ensure that there's elimination that is coming from the mother to child. And Zambia has really worked hard, thanks to the Global Fund and its supporters, in ensuring that we are getting to the 95, 95, 95. The other thing that we have done is Zambia has strengthened community-led monitoring and engagement. Civil society and community-based organizations have benefited from community rights and gender, and the technical assistance and catalyst grants that are enabling a stronger participation in the in-country coordinating mechanism, which is the CCM. And I must also bring to light that through the CCM, we have seen a lot of young people that have shown interest in the youth constituency. And not only that, we have seen that there's been a transition in from the youth constituency going to the people living with HIV constituency. And this is the young people that are advocating and pushing for the advocacy. We're pushing for prevention when it comes to testing and treatment. And also Zambia has introduced, or it's showing more interest in the syphilis and hepatitis B that remain concern. And we are seeing to it that as every young person who is living with HIV is going to access their antenatal services, they are able to be screened for syphilis and hepatitis B. And in line with that, we have also noted to say there's so much young people, especially young women, that are getting infected or affected with syphilis, and we want to see that coming to an end. And again, so thanks to Global Fund and its partners for giving Zambia an opportunity to see to it that we curb these rising diseases. And also to add to it, in 2023, we had 12.0% of adults, which is aging from 15 to 59 in Zambia, were living with HIV, with lower viral load suppression among young adults, who were at 33.6 in females and 36.7 in males. Early infant prophylaxis, which was the postnatal ARVs among HIV-exposed infants, was at 64%. In 2023, again, the Zambian, which is the PMTCT maternal health coverage, improved from 83% in 2022 to higher levels in 2023, which was a plus again, thanks to Global Fund and its sister organization for the funding. Then diving straight to the sub-Saharan initiatives at the regional level, catalytic investment have supported multiple countries with AGYW focus programs, providing proof of concept for gender transformative approaches. The expansion of PMTCT again has improved maternal and child health outcomes, which also is a plus for us in eliminating teenage pregnancies. And also community systems have been strengthened through the CRIG support, enabling women and girl-led organizations to build advocacy capacity and participate in health governance. GBV mitigation has been integrated into HIV prevention interventions. Although funding gaps and lack of full-scale implementation remain significantly challenging, the region has also introduced monitoring and accountability tools such as sex and age desegregation indicators and indicator equality marketer, yet translating analysis into measurable and fully funded initiatives continue to be a hurdle. In summary, Zambia has achieved notable progress with AGYW packages, community engagement, and gender-sensitive programming, supported by measurable impact in reducing survivor-free programming. However, persistent risk among young women and gaps in infant follow-up highlights is a need that we are seeing, and we hopefully during the aid replenishment, we are going to see more investment in this area. Thank you so much, Alia.
Thank you so much, Bester, for that comprehensive overlook of the investment needs and priorities in Zambia and in the context of sub-Saharan countries. Thank you so much for your work also. Like I said, Bester is a Women for Global Fund National Focal Point. I now want to give the floor to Ida, which is the representative of the RAM platform or HAME platform. I don't know if I'm pronouncing it correctly. That I have to say we are counting with the support of RAM platform today to have the translation to French, and also we are having the support from the LAC platform Via Libre to count with the Spanish support. So I wanted to give our thanks to you. And now, Ida, you have the floor.
Thank you, Andrea. I think I will speak in French. And for those who can speak French, you can go to the translation box. Can I share my screen? For those who don't know me, I'm Ida Savadogo. I'm the coordinator of the Francophone Africa Learning Hub. And this hub is hosted by RAME. which is an organization based in Ouagadougou, Burkina Faso.
I think you're able now to share your screen. Let me know if it works.
Okay. Ok, merci à tous. Donc, je vais vous partager les priorités clés et les lacunes pour les femmes et les filles et les communautés les plus touchées par le VIH, la tuberculose et le paludisme en Afrique de l'Ouest et du Centre et les efforts et initiatives en vue de la 8e reconstitution des ressources du Fonds mondial. Et le hub d'apprentissage est basé, intervient dans 23 pays d'Afrique francophone, mais ces pays sont notamment basés en Afrique de l'Ouest et du Centre. Et quelles sont les priorités que nous pouvons relever pour la zone en termes de lutte contre le VIH-Sida pour les femmes, et la tuberculose et le paludisme pour les femmes et les jeunes filles? Je pense que une de nos priorités, c'est surtout lutter contre les inégalités entre les sexes et les normes préjudiciables et en mettant l'accent sur la réduction de la discrimination et également le changement des normes sexistes et des rapports de force préjudiciables qui influencent les risques, l'accès et les expériences en matière de santé, de services de santé. Nous avons une pesanteur socio-culturelle énorme dans notre région qui fait que les femmes sont souvent mises en arrière et ils n'ont pas accès à tout ce qui concerne traitement, prévention et diagnostic en matière de ces 3 maladies. Donc, nous devons lutter contre ces inégalités. Nous devons aussi promouvoir des approches fondées sur les droits. Et comme je disais tantôt, à cause des pesanteurs socio-culturelles, les droits des femmes et des jeunes filles sont souvent bafoués. Donc, nous devons plaider en faveur de réformes de lois, de politiques et de pratiques afin de garantir que les droits et la dignité des femmes et jeunes filles sont pris en compte. Comme priorité, nous avons également l'amélioration de l'accès à des services de qualité. C'est vrai, il y a des services qui sont disponibles en faveur des femmes et des jeunes filles, mais nous devons avoir des services intégrés et de qualité qui prennent en compte les besoins spécifiques des filles et des jeunes filles et que ces services soient aussi pertinents et accessibles dans toutes les régions. Parce que dans les pays de l'Afrique de l'Ouest et du Centre, nous avons ce qu'on appelle les pays à contexte d'intervention difficile où l'accès aux services n'est pas disponible pour plusieurs communautés dues à des effets tels que les sécheresses, les conflits et qui amènent les personnes déplacées internes à fuir leur région et qui fait que là où ils partent, il n'y a pas suffisamment de services, surtout à l'endroit des femmes et des jeunes filles. Quelles sont les autres priorités? Garantir une participation significative. Donc, ça veut dire que dans notre région, on n'a pas cette garantie de la participation effective des femmes et des jeunes filles et des populations touchées dans la lutte contre le VIH, la tuberculose et le paludisme. Donc, ça, c'est une autre priorité pour notre région. Il y a l'intégration aussi des programmes en matière de santé reproductive maternelle, néonatale et infantile au programme de lutte contre le VIH, la tuberculose et le paludisme. Cela permettrait d'apporter une réponse globale aux besoins de santé interdépendants. Une autre priorité, c'est le renforcement des capacités des professionnels de santé afin qu'ils aient les aptitudes nécessaires pour prendre en charge les femmes et les jeunes filles dans les centres de santé afin d'améliorer la qualité et la réactivité des services. Nous avons aussi, en plus des priorités, des gaps qui sont relevés dans notre région, notamment une mise en œuvre cohérente en ce qui concerne les stratégies et les interventions transformatrices en matière d'égalité des sexes. Nous savons qu'il y a un gap énorme entre les droits des femmes et des jeunes filles dans la région, comme je le disais tantôt, et ceci est dû aux pesanteurs socio-culturels. Il y a l'intégration limitée des services dont je parlais tant, parce que nous devrons compléter aux soins VIH, TB, PALU l'intégration des services de santé reproductive, maternelle, néonatale et infantile. Nous avons un gap, par exemple, sur la lutte contre le VIH pédiatrique. Nous avons tenu un webinaire la dernière fois qui montre que plus de 50% des enfants PV-VIH ne bénéficient pas de traitement adéquat. Donc, ceci est un grave. Et avec l'intégration limitée des services, si on arrive à intégrer les services, cela pourrait booster la lutte contre le VIH pédiatrique. Nous avons aussi l'absence de voix communautaire. Oui, il existe des lacunes dans la création d'environnements favorables et durables permettant de renforcer les capacités des organisations communautaires pour s'engager pleinement dans la gouvernance et la prise de décision en matière de santé. En plus de cela, nous avons la persistance de la stigmatisation et de la discrimination, surtout en faveur des jeunes filles et des femmes vivant avec le VIH-Sida, et ainsi que des femmes atteintes de tuberculose qui souvent perdent même leur foyer, qui sont chassées loin de leur famille parce qu'ils sont stigmatisés, discriminés. Nous avons aussi un besoin de données et de suivi sur le genre et qui permettent justement de mettre en place des programmes adéquats en faveur de la lutte contre ces trois pathologies pour les femmes et les jeunes filles. Donc, ce gap existe dans la région. Et également, côté droit, et nous avons besoin d'une réforme juridique et d'une politique suffisante pour perpétuer, parce que ces lois perpétuent les inégalités entre sexes et les violations des droits humains liées à ces maladies. Et cela fait que la lutte contre ces trois pathologies sont souvent à la traîne. Quels sont les efforts qui sont faits et les initiatives qui sont faites justement en faveur des femmes et des jeunes filles dans la lutte contre le VIH-Sida, la tuberculose et le paludisme dans la région? Je pense que nous avons tiré leçon du processus de repriorisation qui a eu lieu depuis mai jusqu'à environ, qui continue jusqu'en début février cette année. Et nous avons vu que, en plus, nous avons vu avec les présentations précédentes de Alia et également de Katie qu'il y a un gap énorme dans le financement de ces trois pathologies dû aux problèmes de financement que nous avons connus. Donc, nous devons essayer de mettre en place des initiatives en faveur de la lutte contre ces pathologies pour les femmes et les jeunes filles. Et c'est dans ce sens que nous essayons de renforcer les capacités des femmes et des jeunes filles à mieux se prendre en charge. Et ceci est fait à travers notamment des webinaires, des rencontres d'échange au sein des pays même, et également à travers des mouvements qui se mettent en place. Et nous avons mis en place tout dernièrement le mouvement TB Femmes Afrique francophone, dont je suis la coordonnatrice, et nous essayons de mobiliser les femmes, les anciens malades et les femmes atteintes de tuberculose afin de les aider à renforcer leurs capacités, à mettre fin aux pesanteurs sociaux, culturels et également à donner leur voix, à donner leur voix dans la lutte contre la tuberculose et à occuper leur place dans les postes de décision, ce qui concerne la lutte contre la tuberculose. Nous avons également des activités qui sont faites au niveau des CCM. Nous avons des postes maintenant de représentants des femmes et des jeunes filles dans certains CCM dans les pays. En plus de cela, nous faisons les plaidoyers auprès des décideurs, notamment le gouvernement à travers le ministère des Santé, le ministère des Économies, également auprès de certains pays donateurs et au niveau de nos pays pour la 8e reconstitution du Fonds mondial. Voilà ce que je peux dire brièvement concernant les défis, les gaps ainsi que les efforts, initiatives qui sont faites en Afrique de l'Ouest et du Centre notamment. Merci.
Thank you so much, Ida, for that comprehensive also presentation from the RAM platform and from the MENA perspective. We are very grateful to have you here and come with your support. I want to now switch the region and I want to go to the ICA region, the Eastern Europe and Central Asia, and I want to give the floor to Ghana. Dovbak, she is also the Women for Global Fund Steering Group member. So Ghana, the floor is yours. Thank you so much for being here.
Yeah, thank you very much for having us here, and I will try to could you hear me well? Hopefully you could hear me, and hopefully you could see my presentation very short. Could you? Yeah.
Yes.
I need to start with this words repressions, and it's not only because we are all time repeating the shrinking space for civic space of civil society and for communities, but actually what is happening in the region, that it was never funded well, but in the same time, majority of programs for key populations, for women from those who are using drugs, who are living with HIV, who are providing sex work, so involved in sex works, for LGBT people and trans people, and for women in situation of the gender-based violence. Majority of the services still dependent from the Global Fund and from international funding. And now with the budget cuts caused by the US administration decisions, that's even much harder. But in the same time, countries in our region, they are shrinking the possibility to receive funding, and that's what I wanted to share. And that's why we need to have the proper support from international, from the Global Fund in funding model, but also from international community, from EU countries, from US, in the political mode, in political will, in supporting harm reduction and in supporting civil society providing services to women and to vulnerable women and girls. So that's to share with you that there are several streams of repressions which majority of our members are feeling. And one is the foreign agent law, when all organizations receiving so-called Western funding, foreign funding, they are under threat. And the second issue, it's more about the traditional values, and we all face it all over the globe, I understand. But in this case, they're combining it together with the same, repeating the same language as a only two gender, and putting it in the constitution, like the banning of services for LGBT people, for trans people in the constitution, for example, the crazy legislative initiatives. And the third part is about drug propaganda, and under this we could see all banning all harm reduction information providing services and all of this, and this two gender and banning the language on gender equality, when it goes together from US funders and from US funding, like we are banning this language and these programs, and then from the state, then organizations and activists becoming very threatened. It's just to show that it's not only in one country we are screaming about, but it's about a lot of countries. And with the foreign agent law, you see that how many countries already have it. And for example, we have Georgia, where even consultants receiving international funding or receiving any money to do work for LGBT, for our key groups, for women, or for gender equality, any research work, any international work, they could not get this money, and they will be announced as a foreign agent. I don't want to blame Georgian government more, but that's really now becoming very, very dangerous for all activists and for all organizations. That's very important, and I need to highlight. With the drug propaganda, you see how many countries already step in this war on drugs, and criminalizing the drug propaganda, and under this, all information about harm reduction and reducing harms and non-repressive drug laws goes there. And I like Hungary is a very bad example. Being EU, it's very and again with anti-LGBT law, it goes together with this two-gender language, and it goes together with the limiting gender transformative or gender supportive interventions. So that's just the overview. I know that I have just 5 minutes, and we are all together, different communities, from sex workers, people living with HIV. We are all united in the solidarity. It doesn't help much, unfortunately, but that's where we need to be supported. So in addition to what my colleagues said from other countries, that women still in need of all this complexity of services and support, and it's not only related to HIV, but it's broad about the broader health and protection from violence and children health. It's all goes in this threatened environment, and if we will not have proper investment from the Global Fund, we could not survive, and that means that our beneficiaries, our people we are serving, could not survive. Thanks.
Thank you so much, Ghana. That was a very powerful statement. I want to complement the voices from the ICA region, and I want to also give the floor to Victoria Kaliniuk. She is the regional manager of human rights program in React platform. So Victoria, also the floor is yours. Thank you so much for accepting and being here.
Yes, hello, do you hear me well? Yeah, okay. So it's a big pleasure for me to speak after my colleague Ghana, who also shared a very detailed analysis of what is going on currently in our region. So I would like to speak more about what is our response to that actions and what we tend to do to confront these challenges. So Eastern Europe and Central Asia region, it's a region where progress against HIV and TB is deeply intertwined with struggles for human rights, gender equity, and the survival of community-led organizations. And the Alliance for Public Health, the organization I represent, coordinates the largest regional partnership in Eastern Europe and Central Asia, supported by Global Fund, and our efforts are to strengthen and sustain all these actions, and with amazing women leaders within our partnership at the forefront. In Eastern Europe and Central Asia, the region with the second fastest growing epidemics, the challenges we face are not only epidemiological, but they are also political and structural. And I would like to highlight these three urgent realities: shrinking space, which Ghana described in detail, funding cuts, and the rising backlash against human rights. Across our region, civil society is increasingly under attack. Laws restricting foreign funding, crackdowns on independent organizing, and harassment of human rights defenders are closing the space for women-led and community-led organizations to operate. Without their voices, there is no meaningful gender equality and no effective response to HIV and TB. We see this clearly in Kyrgyzstan, where new laws on foreign agent are shrinking the space for NGOs. Community-led organizations that provide critical HIV prevention for women who use drugs. And
sorry,
yes,
Victoria,
sorry.
can you slow down for the translators?
Sorry, yeah, sorry. I just wanted to save some time, so sorry for being so fast. I will try to slow down. Okay, so community-led groups that provide critical HIV prevention for women who use drugs and for sex workers are struggling to survive under increasing attacks and persecution, and yet they remain at the front line of the response. We are also witnessing a decline of international funding across Eastern Europe and Central Asia, while national governments are either unwilling or unable to finance right-based and gender-responsive programs. And domestic resources often ignore or intentionally exclude the communities that are most affected by HIV and TB. And on the other hand, take Ukraine, where the ongoing Russian war has devastated health systems and displaced millions of people. Despite incredible resilience of community organizations, including women-led groups, funding gaps threaten HIV and TB programs at the very time they are the most needed. Without the Global Fund, services for women living with HIV and for displaced women and for survivors of gender-based violence would simply collapse. And this is why our organization, Alliance for Public Health, based in Ukraine, has been working to mobilize support for the AIDS replenishment. We have built a coalition of 141 Ukrainian NGOs, and we are coordinating letters preparation to key Global Fund co-donors, collaborating with international partners, raising awareness in parliaments of key co-donors, and preparing reports and materials and organizing events to amplify this message in the media. These efforts are critical to ensure that the most affected communities continue to receive life-saving services. Amidst the ongoing challenges of Russian war, Ukrainian healthcare workers and mobile clinics continue to provide life-saving HIV and TB care. The Global Fund produced a film about the work of Dr. Yulia and her mobile team in hard-to-reach areas of Ukraine, which is called Face the Front Lines of War to Deliver Life-Saving Care in Ukraine. This film is a part of Global Fund global campaign in support of AIDS replenishment. So another important issue we have in our region is gender inequality that's been deeply intertwined with economical crisis, displacement, and discriminatory policies. Adolescent girls and young women continue to face high HIV risks, fueled by gender-based violence and harmful norms that limit their ability to protect themselves and to access care. So friends, this is why the AIDS replenishment of Global Fund matters so much. It is not simply about numbers on a donor pledge sheet. It's about ensuring that Global Fund continues to be a lifeline for women's group and community-led responses across Eastern Europe and Central Asia and beyond. So we call on governments, donors, and partners to fully fund the AIDS replenishment. Only with robust resources we can protect the gains and we can accelerate progress. We call to prioritize investments in gender-transformative community-led programs, especially in regions like Eastern Europe and Central Asia, where other funding streams are shrinking. And we call governments and donors to stand firm in defending human rights and civil space, because without rights, there can be no sustainable health outcomes. Thank you.
Thank you so much, Victoria, for your presentation. And thank you so much to all the speakers, Gana, Ida, Katie, Bester. There is so many different situations and realities that the Global Fund addressed, and women and girls are in the center of usually all of the bearing the brunt of the conflicts and inequalities. And so thank you very, very much for bringing that perspective and those insights. I know we have regions that are that were left on this conversation, but they are included on a regional analysis. And I want to now jump into the cake of the webinar and present to you a toolkit that it's going to be for us. We created this for it to be a simple and a very useful guide to your advocacy in this regard, so the advocacy in replenishment. And as we know, I'm going to share my screen to to introduce the toolkit. As we know, there is so many arguments that were already discussed in this webinar. But the toolkit wants to give you all of the information that we use to also produce our own advocacy as Women for Global Fund. I want to first ask you if you can see my screen. You can see what I'm sharing. Great. So here you're going to find on our website, this is the Women for Global Fund website, the menu, right? And in the Get Involved button, you're going to get a display of different options. The last one is the Aid Replenishment Communication and Advocacy Toolkit. And like I said, this is a toolkit that includes different tools to prepare your advocacy, to have all of the options and tools to advocate in your own country and in your own terms. And that's why we wanted to produce and developed a very comprehensive toolkit to give you the perspective of today's international environment and how we can make a difference from our realities and from our country. So you're gonna have at the beginning of the toolkit a very quick but powerful introduction of why we as feminists we get involved in the Global Fund's aid replenishment, and we are very inspired also by the GFAN reframing solidarity campaign, because we want to also reframe the investments of made in health and made in gender transformative programs as the best kind of economic investment our countries and the international community can make. So the first document you're going to find on the toolkit, it's the major donor analysis, right? It's giving the document has a main goal, which is to give all of the information you need to know how to talk to donor countries, to know what are the priorities of donor countries and how to use their language to approach them and to advocate within them, right? And we, here in this document, lay out all of the priorities and all of the recent discussions that donor countries have been having around ODA and around multilateral investment. We know that in a times with multilateral cooperation, it's in crisis. We want to have all of the tools so we can navigate and we can leverage all of our initiatives in this very complex scenario that we're living and we're going through. The second document, as Alia also introduced at the beginning of the webinar, is the regional analysis document, where we lay out an analysis from the different regions to know, for you to know what kind of investments is the Global Fund doing in these regions, what are the priorities of the Global Fund in this region, and what are the challenges, right? What are the challenges to sustain for the sustainability of the programs? And what are the challenges for women and girls in the diversity and key populations? Please go to the toolkit, download the regional analysis. We are very proud of this document, that it's the representation of our movement, the representation of you in the different countries and that of you that are leading communities and leading the implementation of Global Fund programs. Then the third document, it's a very short document that we're also very, very proud of launching today, which is the Advocacy Roadmap for the Aid Replenishment. This document is a very short and useful document for navigating step by step how to make a difference in this scenario with our with all of the constraints that we also have as civil society, and sometimes the big challenges of the world seems so hard to tackle, but the advocacy roadmap tries to give a very simple step-by-step approach. And I want to just briefly also update you what has been the strategy for the aid replenishment campaign and advocacy campaign from our side, which is try to develop a campaign that feels from the ground and on the ground, from our countries and our realities. So the national focal points and flourishers and all the Women for Global Fund movement have been developing letters to the North countries and have been developing letters to decision makers in the implementing countries of the Global Fund programs. As our national focal points are representative of those countries, like Zambia, like Pakistan, like Tanzania, Malawi, Ghana, Uganda, Cameroon, Nigeria. And also, as in the Women for Global Fund team, we're also all parts of Global Fund implementing countries like Morocco, Ecuador. So what we have been doing is to sending letters, sending petitions, sending also petitions for information to our governments, and introducing in those letters key data points and evidence-based arguments on why investments in our countries from the Global Fund has been transformative and are more crucial than ever. So the advocacy roadmap that we encourage you to read, to download, it's a very simple step-by-step on how you can do this too, how you can use the letters, use the templates, and map all of those decision makers, and map all of those embassies representatives, so we can have all of the channels and all of the ways of doing our advocacy fulfilled. We are mighty, and that's why we try to get all of the opportunities we have to advocate. So that advocacy roadmap is the document for it. And then you will have also communication materials that we present on the PPT, but we're still developing more. Please go to our social media, share all of the communication materials that are the result of of the research and the result of the voices from advocates in our movement. The communication materials, like these infographics, have one goal, and which is to summarize with evidence, and to summarize the evidence and to summarize the results of the investments made by Global Fund, and also to summarize what are the challenges and what are the risks if we don't get a fully funded Global Fund. You will find also key messages just for you to copy and paste and share on social media. You can tag us along also on social media with 3 main hashtags that we want to consolidate and we want to position, which is replenish the world and aid replenishment and aid for equity, and our ongoing and constant hashtag, which is fund her health, that for us summarize the mission and the vision of our movement. So you will have plenty of key messages that also reflect the diversity of our movement, the diversity of needs of women and girls. And finally, in the communication and advocacy toolkit, you will find links to the communications campaign from partners like GFAN, like GFAN and GFAN Asia and GFAN Africa. you can just click on the images and you will get to the websites, the official websites from their campaign. So please, I will send the link to the group chat, and what we want you is to explore the toolkit, use the materials and the documents, especially in this last mile, because we know we're going towards the end of the official campaign, but this is information, and we think that they're useful tools to use even beyond the ad replenishment, because it is a reflection of the needs and the priorities of women and girls in terms of their health and in terms of investment in health and gender transformative programs that tackles, human rights barrier, gender inequality. So we think this information is useful even beyond. So I will stop here because I don't want to over talk, and now I want to give the floor to questions, to answers. I want to open the floor to a discussion. If something sparks on your mind after you hear those amazing speakers, we're also very happy to hear you now. So we are going to take now the comments, the questions and answers in this section. So please go ahead and just raise your hand if you have any. I see there is no one yet. Oh, yes.
I will just also encourage the audience to put any comments or questions on the chat. It would be a space section. Please also don't forget to join as an advocate or lead server or mailing list and social media. I think we are connected through those networks easily. Is there any other comment? Otherwise, we can proceed probably to the next part of the session, which will maybe the closing remarks.
Yes, and also I want to remind everyone that the presentation, the webinar, and the toolkit link will be sent to your emails.
Thank you. Then probably, Andrea, we can just go to the.
Yes. So let me just share.
Share probably your screen, and then in the meantime, I'm absolutely inspired. I'm overwhelmed with this amazing number of great people that is with us. And it shows the power of the movement. It really shows the power of the advocacy and what we are planning to better enhance and strengthen in the upcoming days. And as I'm saying, also beyond the replenishment, just want to remind also our colleagues and friends and advocates that we have additional advocacy tools. In this past years, we have produced around plus 62 advocacy briefs and technical tools around different topics that are important to women and girls in our diversity. And you can all access them in our digital dossier and our web page and our social media. So please make the best use of these tools that are available for all of us to keep on advocating for a gender transformative HIV, tuberculosis, and malaria response. And we now need to keep on pushing to have what life-saving means to us in terms of comprehensive services for mental, physical, and eliminating all these structural systemic barriers that are not allowing us to fully flourish as women and girls in all diversity. Also, I want to give finally my special recognition to our national focal points that are leading this work in the ground alongside our amazing flourishes that are also present here in this webinar and are conducting the advocacy from their own countries all over the global south. Just please go again to these resources that we have prepared for you. Don't forget to follow us in social media and support also our campaigns. We have put the hashtags for you to also include them into your campaigns. And also, if you want us to disseminate your initiatives, campaigns, and actions, please also contact us so we can collectively enhance the voices of women and girls in all the diversity and push for this last mile on the Replenish the World campaign. And of course, fund her health, which is our key message all over the time. You can scan the QRs. And thank you so much for being part of this amazing journey. We have made significant strides. We need to make this more visible. We need to just strengthen our work together. And we are working together to championing health and equity and gender transformative actions. Please support our mission, amplify the collective impact we are making. And thanks again for this amazing present today and powerful messages from the different regions that we have been able to invite today. Don't forget to check also the last documents that Andrea was mentioning. We will be sharing also this to the Lee server. And if there's any additional question, we are happy to take them also afterwards in bilateral conversations. So thank you so much for this time, and I hope that we can see each other afterwards. Here are our contact emails, and happy to just collaborate with other organizations and movements also present afterwards. So please feel free to just contact us so we can enhance our efforts together. Thank you very much for the work that our gender advocacy lead, Alia, is also doing in Morocco. Andrea also present in Brazil. Our steering board members that are also present in this webinar today. And of course, a big thanks also to the interpreters. So they help a lot on the Spanish and French channels. Thanks to the Via Libre platform and also the RAN platform. See you next time, and thank you so much.
Thank you.
Thank you.
Thank you.
Oh.
You have a wonderful day.